Hi guys, this is Ava from Bay Harbor Med Spa, and this is a very interesting question that I haven't answered in a long time, and so this will be very interesting for a lot of you out there that are listening. This question came from Zoe. Zoe is 20 years of age, and she's asking a specific question. Her question is, she said that she has dryness around her eyes and dryness above her eyebrows, but then that she has a very oily nose and the rest of the skin, and she wonders if I can suggest a product or makeup that could improve this. So first of all, guys, when you have dryness and peeling, flaky around your eyes, in your eyebrows, above your eyebrows, and the rest of your skin is oily, that is telling me that you have either an eczema or a dermatitis, some kind of skin irritation, inflammation, if it's dry around your eyes and above your eyebrows, and that this would be probably linked to some irritant like makeup or a cream that irritated you, because it's to a specific area. It's just around the eyes and above the eyebrows. So there is one, that it is due to an external thing that you used, and it's either old or bad, or it gave you a fungus, it gave you an infection, it irritated you, it dried your skin to an extent that it's sort of flaky around your eyes, and it comes from internal. So it can be makeup, it can be a cream, it can be a product that you put on your eyes, it can be a fungus, it can be that you didn't wash your hands, so you touched something and then you rubbed it in your eyes and you got a fungus in your eyes. So it is not a question of whether there is a product or there is a cream or there is a makeup that I could suggest. We don't know what you have. Um, so that is the first one. The other one is, but I'm not sure again, because I'm just grasping at what you guys write to me without sending me a picture. The other one, sometimes there are people that have a permanent condition, and the dryness actually happens here around the nose and sometimes around here, and that is a skin condition that sometimes will stay for the rest of your life, and it will flare up at times, and then there are some medications that a dermatologist can give you. It's some corticosteroids, that it calms it down and then it goes away. However, since I don't see it, number one, and number two, I cannot determine which of the two problems you have. Is it an infection? Is it an irritation? Is it an irritation to something that irritated your eye and now you have dryness and flakiness because you are allergic to a product? Or is it heredity? Is it some kind of dermatitis or some kind of eczema? So I can't tell you. What I would suggest that you do is, it's well worth it, because remember, this is your skin and these are your eyes, so you don't play with it. If I am you, I would see a dermatologist, or I would see a eye doctor, somebody who could look at you, and then they most likely will give you an anti-inflammatory, something to calm the skin down. If that is not possible for you, for financial reasons, whatever, and you can't see a doctor, then the next best thing I would suggest is for you, try to go to a pharmacy such as Walgreens or CVS or something like it, or Rite Aid. I don't know which state you are in. Go to the pharmacist and ask the pharmacist if he or she could recommend you something for whatever you have. I don't see it. Maybe they will say, oh, okay, try this or try that, just by looking at your skin. So I personally would suggest that you see either a dermatologist or an eye doctor. If you can't do that, try to see pharmacist that could tell you, at least by looking at you, what you have. Most likely, it will be a topical corticosteroid. It's a cortisone cream with sometimes cortisone and antibiotic cream that they would give you for it to go away. But since I don't see you, I'm not your physician, I can't tell you. I'm just grasping in the air. So I would not suggest for you to buy my products or buy my mineral makeup or buy my microdermabrasion scrub or buy my aromatherapy oils, because I don't see what you have, and it would be totally irresponsible on my part to try to sell you something because, number one, you are vulnerable, number two, because you think that it is just something, and so okay, so it's a makeup or it's a cream. I won't do that. Maybe other places will, but I won't do that. I like you to go clear this up by one of the forms that I suggested. And then once you clear this up, if after that you contact me and you tell me, okay, this is gone, I would like to use your product, I would like to use your microdermabrasion or to get rid of the oily skin, I would like to use your moisturizers or your mineral makeup, yes, by all means. But right now, no, darling, I'm sorry, I can't. I need you to do the right thing for yourself. Okay, so I'm sorry if I upset you and I don't answer you the way you would want, but I'm too long in my business. I am a mother, I am a woman, I am a professional, and I treat all of you as if you were my clients, my patients, my children. I treat everybody the same way. So I just couldn't do this. If you were in Miami and you came to my clinic and I couldn't identify what it is, I would tell you the same thing. Go first of all and get this treated, get a professional opinion, and then or professional treatment, and then we can talk. Okay, so until next time, I hope I answered it to the best of my honest ability. So until next time, until I talk to all of you, and I talk to you because I know you will appreciate me in the long run, when you will solve this problem that I didn't try to sell you anything, then I will gladly sell you whatever you need. So until next time, ciao guys. Thank you. Bye bye.